Everyone is at risk with this novel coronavirus. Our public health agencies and our governmental agencies are failing us. They are not addressing the root causes of where these infectious diseases are coming about. The wildlife trade with the Wuhan market, the wet market in particular, is just the tip of the iceberg. It would be too easy and too simplistic to blame the current pandemic situation that we're facing on just these wildlife markets in China. In the past few decades, 3/4 of the new viruses that have emerged have come from other animals. We're talking about the MERS coronavirus, SARS, the Nipah virus, the Hendra virus, Ebola, even HIV, and of course avian and swine influenzas. We are encroaching on their habitats. We are putting human population in closer contact with species that we may never have been in such close contact before, and that makes it easier for the virus to be transmitted into the human population. And of course, factory farming is a huge culprit. The feeding of animals in factory farms antibiotics is a huge factor behind these increasing numbers of bacteria which are resistant to antibiotics. You have animals so jam-packed into these factory farms. They're treated so horribly and they're so miserable that their immune systems are down. So it makes it easier for animals to catch infectious diseases from one animal and then spread it from animal to animal like wildfire. And each time the virus spreads from animal to animal, it has a greater chance of mutating to a deadly form and one that is very contagious among humans. When people get sick with a virus, like coronavirus, like the flu virus, their immune systems are down, and that makes them more prone to getting what we call secondary infections, which are often bacterial infections. And often, it's the bacterial infection that comes later that is what it ends up being lethal for an individual. And so in these cases, antibiotics are crucial, they're vital. If we really want to protect ourselves and protect our future generations, protect our kids, protect our families, we also need to look at protecting other animals and not treating them as commodities. And we have to start treating them as sentient beings. We have to use this situation to learn and to become better and to become more prepared for the next potential outbreak, the next potential pandemic. By going on a plant-based diet, by being vegan, we're more likely to protect ourselves from heart disease, from stroke, from other chronic diseases like diabetes, from many forms of cancer, and we're more likely to protect ourselves from new infectious diseases because we have minimized the situations that can create these new infectious diseases. My name is Aysha Akhtar. I'm a neurologist and a public health specialist. I am the Deputy Director of the Army's Traumatic Brain Injury Program and a Commander in the Public Health Service Commission Corps. I'm also a Fellow of the Oxford Center for Animal Ethics.